Hi, in this video we'd like to talk about the three common causes behind labor pains. So this is very suitable for women who are avoiding pregnancy because of the horror stories that they have heard, and then because they are very pain sensitive, they are very afraid of getting pregnant because of labor pains. Let's go through what is actually causing the pains. So straight to the point, the first point is actually psychological. The pain that you are feeling, many times it's not that intense, but your brain, psychologically, it will amplify it because you believe that it is going to be very painful. Now, these kinds of thoughts are already implanted into your mind way before you considered pregnancy, since you're at a young age, watching movies, TV shows, storybooks, and any other content, even from your friends and family. You hear stories that labor is one of the most intense pains a person can experience in this life. On a scale 1 to 10, they will say labor pain is a 10. And because of these kinds of narrative, many women already have a predisposition on being fearful. Psychologically, they are already very scared of getting pregnant. And then when they have these kinds of thoughts, when labor actually happens, then it will amplify it. But in reality, labor is nowhere near that kind of exaggeration, because your body will actually produce hormones to help you deal with the pain. So take it with a grain of salt, whatever you hear in media, because in reality, labor pain is never that intense. Second cause of labor pain is a lack of oxygen. So specifically, I mean that the muscles of the uterus, the smooth muscles, experiencing a lack of oxygen. So smooth muscles, they have a very unique characteristics. They can contract longer than skeletal muscles. Skeletal muscles are the muscles that we can contract consciously. Smooth muscles are involuntary. So these muscles, they're much stronger and they can resist pressure much more intensely. And they also do not feel or receive any pain, because there are no nerve endings on smooth muscles. So you will never know if your smooth muscle is injured. However, there's only one thing that can cause smooth muscle to experience pain, which is a lack of oxygen. So when contraction occurs during late stage pregnancy towards labor, when the smooth muscles of the uterus start to contract, the blood vessels start to get suppressed. They start to get restricted, squeezed because of the contraction. When these blood vessels get squeezed, and then there is very poor delivery of blood, very minimal, very little blood gets through during this contraction, and then overall these muscles experience a drop in oxygen delivery. That is what's causing the pain. This is very natural, unavoidable. However, there are procedures that you can take to ease this pain. For example, here at Antai Hospital, water birth is one of the best effective ways to actually calm the nerves and also reduce this kind of lack of oxygen, the uterine smooth muscles. Because of lack of oxygen, they're causing intense pain. These all can be dealt with if you take your time, do not rush the delivery, and then water birth is something that you can consider because it deals very well with these two factors. Third cause for labor pains is due to the dilation of the vaginal canal. So during labor, when the baby is exiting the cervix via into the vagina, then the vaginal canal needs to dilate many times so that it can contain a fetus, so that it can exit via the vagina towards delivery. So during this stretching, sometimes there is some pain here, and then if there is too much stretching, excessive stretching, causing some tear, then they will cause some further pain. So how we need to do this is that we need to avoid this kind of excessive stretching, and we can keep the pain very minimal if we don't rush the delivery process, which is why here at Antai Hospital we always recommend our patients to go for water birth, because water birth is very effective in dealing with all three causes of pain during labor. Many women compare it to be a very painless delivery method. If you rush it, if you do a C-section, very likely you will feel some level of pain, although not as intense as what the media portrays or certain stories or rumors that you hear. So I hope you've learned something here in this video the 3 causes of pain, and the primary cause is psychological. Secondary cause is lack of oxygen due to the uterine muscles being contracted intensely, and then third is due to vaginal canal dilating excessively, causing some tearing. So do visit our website if you'd like to find out more information about water delivery, water birth. This is our Antai hospital specialization. Leave me a comment down below.